well over a year, doctors have been studying patterns and trends of COVID-19, even in some ways that might not come to mind right away. In tonight's Eye on KELOLAND, Max Hofer shows you how two from Vermilion are using wastewater to study the coronavirus.
When it comes to researching COVID-19, University of South Dakota biomedical professor Dr. Lisa McFadden is letting nothing go to waste. Literally. Since July, she's been using wastewater to research spreading trends in COVID-19.
The country and the world actually has been using wastewater surveillance for about 40 years now. It started with monitoring polio, which is a virus that has similar properties.
They're using similar techniques to measure the community spread within Vermilion, South Dakota.
The unique property with wastewater is that both symptomatic people and people that don't have symptoms of COVID-19 actually shed it in their feces.
Helping her in this pursuit is Dr. Victor Huber. He specializes in studying influenza viruses, vaccine-induced immunities, and secondary infections.
It's an important thing to get the experts in the scientific community together to provide their expertise towards solving this problem.
Since he's been at USD, he's researched two pandemics, including the 2009 H1N1 pandemic.
You get an opportunity to see what virus is present. Even if you're only catching it at the time that the cases are happening, you still get to have an idea of understanding sort of the presence of the virus, whether it's SARS-CoV-2 that's causing the illnesses that are being seen.
They get their samples from the Vermilion Wastewater Treatment Facility a couple times a week.
And we've been finding some really interesting findings in that it's really highly correlated with what we're seeing on the clinical front.
It's almost impossible to keep up with the sort of number of manuscripts and papers and new data that's coming out on pretty much a daily basis.
Huber says that they're also studying immune responses from people who have the coronavirus.
And trying to understand, how those antibodies recognize the virus itself, and then, especially in the sort of emergence of these new variants, how that's going to change over time.
Dr. McFadden says that with all of their resources, they can have test results in just a matter of hours.
We've found trends that actually match our clinical testing parameters. So it matches clinical cases in the county and other measures like that.
As far as cases go, Dr. Huber says the city is doing well. They then share the data with the university's COVID-19 task force to determine the appropriate measures the campus needs to take to ensure safety and prevent further spread.
I think we had a large sort of case number in the fall, but I think lately they've been staying pretty consistent in their numbers. It's not gone, but it's consistent.
So we're hoping this is being helpful to them and just helping the community in general.
With Eye on KELOLAND, I'm Max Hofer.